Well, today we're going to talk about one of the more common respiratory disease in horses called strangles. And strangles is caused by a bacteria called strep equi. Now think about kids, if they get strep throats. Well, young horses are predisposed to strep infections similar to what young kids get, and it's called streptococcus equi. It's very contagious from horse to horse, and what you'll typically see is drainage coming out of the horse's nose, or you'll actually see swelling underneath their jaw in this area, sometimes behind the jaw right here. Again, once you start seeing swelling here underneath the jaw of a horse, it's usually too late to treat the horse with any kind of antibiotic, and you typically it'll develop an abscess, and this abscess will need to come to a head, and you allow it to break and drain. Now, if the horse starts to show a fever, goes off feed, has any of these more severe signs, then it may need to be treated with antibiotics or taken to a veterinary hospital. Again, anytime you have a horse that has that problem, you need to isolate it because it is contagious. It can be spread from horse to horse. You don't want any kind of nose-to-nose contact or any contact with the drainage that's coming from the horse's nose. The characteristic color of the drainage is usually real white, kind of a yellowish white, real thick drainage coming out of the horse's nose, or from the abscess when it drains underneath their neck. And you'll see it if you go to like rodeo grounds, fairgrounds, horse shows. A lot of times there's a very effective vaccine for strangles that generally diminishes the severity of the disease and limits its spread from horse to horse. Strangles can be a life-threatening disease, you know, and so what can happen is these abscesses can go inside of their body and affect their major organs. You can get a complication called purpura, where their legs all swell up. So you definitely need to get your veterinarian involved if you suspect strangles. You certainly don't want it. Most of the time it's kind of a routine problem that runs its course, but I'd say 2 out of 10 times it can turn into a complicated case that may be a life-threatening problem that you'll need to deal with in a more aggressive manner.